Hello, I'm Sherry White, nurse practitioner here at Illini Community Hospital. I'm coming today to introduce our new team here at Illini. We're excited to have, this is Dr. Jalad, Dr. Wesley, and Dr. Mimmin. We are going to be providing services for oncology here at Illini. Many of you know me already through the primary care piece and also through oncology. Been here for 13 years. We're going to start over here with Dr. Jalad. Can you go ahead and introduce yourself and tell us a little bit about you?
Absolutely. So my name is Basil Jalad. I'm one of the hematologist oncologists at the Blessing Health System. I've been here since 2017. Before that, I was an assistant professor at St. Louis University. I'm still adjunct assistant professor with them, teaching fellows there, and I'm also the medical director of the medical oncology at the Blessing Health System. I'm so excited to start that service at Illini location. I think this is a great step forward, for our patients and our community.
Definitely. So we're very excited here also. So then I'm going to start over here with Dr. Mimmin. Would you introduce us?
So my name is Isaac Mimmin. I'm hematologist oncologist in practice for almost 18 years. Done my fellowship at University of Pittsburgh and then moved to the Chicago area. And I've been in the Chicago for almost 18 years and now moved to the Quincy, make my second home, or in fact first home. Been here for 7 months and obviously got this opportunity to start the clinic here at the Illini, and I cannot be excited more, and provide the services. We are providing excellent service at the Quincy.
All right, and then Dr. Wesley.
My name is Osvaldo Wesley, and I was at the Springfield Clinic for about 17, 18 years, and then I left there to do more hematologically related things, more hematology, and then eventually I kind of got homesick and came back to do more oncology. And so I've been with Blessing for about 2 years, and this is a great opportunity to now be able to sort of be the physician here at Illini, so that there is someone that is always here, can always be counted upon to be here. I live not far from here, so oncologic care no longer needs to be someone who comes in from time to time. We never know who's there. No, that Wesley guy is here, will always be here, can be counted to be here, and you can reach him 24/7 all the time. I carry my phone all the time, and I really would like to help as much as I can to grow oncology here in Illini.
We're very excited to have you. So,
I know, Dr. Wesley, you're humbled to mention that, but I know that you were recently awarded by former President Obama. Tell me, what was it? Remind me about it.
I'm not a fancy guy, but they gave me the award in 2014 as the best hemophilia doctor in the country, which is kind of crazy.
that is amazing, and we're so lucky to have you here in Pike County. So you don't have to go far away. You don't have to go to Barnes. You don't have to go to Mayo. You don't have to go to MD Anderson to be able to get top-notch cancer care. You can get it right here in Pike County because we have amazing doctors that have great backgrounds and great education and know exactly what they're doing and what they need to do to take care of your specific need.
I mean, us as a hematology oncology service is one part of a great team taking care of patients, cancer patients. One of the major services we also provide is radiation oncology. We have a great team in the Quincy campus, and with state-of-the-art technology of providing, radiation oncology services when in need. We also have multiple other subspecialties when needed, including pulmonology, with also their state-of-the-art instruments for doing biopsies through bronchoscopy, cardiology, nephrology, whatever it takes.
And many of those subspecialties do come to Illini in the consulting physician clinic, so patients don't have to travel outside of town to get those consults done. Once in a while we have to go out of town for the actual procedure, but for the consultation and the follow-up and things like that, we can do that right here at the hospital.
Absolutely.
I want to add about the radiation. I think one of the things most of the people know, the radiation required and continued Monday through Friday kind of treatment, and sometimes it's 5 or 6 weeks, and we don't have the radiation center here, But with the newer technology, some of the radiation can only be comprised for 4 or 5 days. You know, for a small pulmonary nodule, you don't have a surgery now, you don't have the chemotherapy now, you can have what we call a cyber knife, you know, and that can be taken care of very small number of radiation treatment, you know, which is really great advantage for the patient who lives outside the Quincy area and they have a commuting issue logistically.
And speaking about commuting issues, we do have 2 buses here at Illini that can be utilized to help patients to be able to travel to and from either Illini or Blessing that was within a 50-mile radius of the hospital for those incidents where patients have difficulty getting to and from their appointments.
That's exactly the reason, you know, I mean, the short course of radiation therapy has really, really great value.
Yes.
Because it's required only few treatment and
So
patients
much
very
easier.
comfortable of coming
Yes.
back and forth.
Yes, so much easier. And we work closely with Dr. Gill and Dr. Johnson in the radiation department on a daily basis, so.
Yes. And worth mentioning also that there is an infusion center relatively
Yes.
new here with
Yes.
and we are able to provide any of the newest advent in in cancer therapy, not just the conventional therapy like chemotherapy, but we also provide immunotherapy, we or target therapy, whatever is being given in the big centers, and it's located right here
Yes.
in Illini and in Quincy. Yeah.
And we have awesome nurses that provide free entertainment, so you can't beat that.
That's right.
I agree.
Dr. Wesley, you know, I mean, you being close to the Springfield, you know,
Yeah.
from, what do you think? You know, you probably know this area more than anyone else.
Absolutely, absolutely. The key is that I've made Central Illinois my home for the last 27 years. This is our home where we've raised our children. They've all gone to the University of Illinois. I've lived in Springfield, so I know the Springfield medical community. I was, of course, there at the Springfield Clinic for 17 years, and I know, having now seen Quincy, that the quality that Quincy shows and has, it can extend here to Blessing. And if we need something to access that is available in Springfield, I know that environment very well. I think we can satisfy anything with the combination of Blessing and Pittsfield, but if we ever do need something in St. Louis, Dr. Jalad knows St. Louis. If we need something in Springfield, I know that well. I still teach at the medical schools there, so we have access to studies if we need them. So we really are bringing very, very much the more full scope of places here to Pittsfield.
I agree with you. Those routes that we have that is very close to the central of Illinois, St. Louis area, Springfield or Chicago. I think that would be also of help if we need any any tertiary referrals, whatever needed. I don't think we needed that much. I think with the technology that we've already invested, in the Blessing Health system, would bring a lot of what's needed there to the
Absolutely.
community,
Right.
and maybe even cheaper.
Yeah, I would agree.
Oh, yeah.
So.
I think that we are able to bring knowledge of Chicago and knowledge of St. Louis and Springfield to be able to stay here. It helps patients not have to travel away from here to access the same quality of care, keeping it here in Pittsfield, and anything that is needed from those places. We also have people who know those places if we need it, but with this team, the likelihood that we'll need to leave here is decreasing because it's all here.
I think it's a unique combination.
Very good
Very,
combination.
very. Thank you for joining us again, Dr. Jalad, Dr. Memon, Dr. Wesley, Sherry White, Illini Oncology team. We're so excited to be able to help take care of your needs. Please reach out to us if you ever have any need for our services or any questions.
Yes.
Thank you.